Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. Today we have Dr. Williams and Dr. Yaffe here, so I'll turn it over to them for some brief remarks.
Good afternoon, and I hope everyone had a good, safe, and healthy weekend. The weather was quite amazing for Ontario, so we'll celebrate that. Knowing the contrast with other parts of Canada that had snow and quite inclement weather in that way, so it shows you the variety we have in a country the size of Canada, much like the size of Ontario as well. So we'll start off with, as usual, we'll look back at the numbers. I'm going to hand things over to Dr. Yaffe to talk about the numbers we have seen and what we have today.
Okay, thank you. Thank you very much. For the last 4 days, Ontario has recorded over 1,000 new cases of COVID-19 per day, with a record high of 1,328 new cases on Sunday. Today, we're reporting an additional 1,242 cases of COVID-19. The 7-day average now stands at 1,106 cases, which is up from 919 1 week ago. Most of the cases reported over the last few days continue to be concentrated in Toronto, Peel, York, and Ottawa. But we are seeing elevated numbers in other jurisdictions, particularly in the Greater Toronto Area, as well as in some of our northern health units that have traditionally seen low daily case numbers. For example, Sudbury reported 14 cases on Saturday, 12 cases yesterday, and another 8 cases today. In terms of our testing, Ontario's 7-day average stands at 33,716 tests processed per day, with a positivity rate of 3.9%. System-wide yesterday, there were 28,401 tests completed, with a positivity rate of 5%. Today, hospitalizations declined by 7 to 367 across the province, with 84 patients in the intensive care unit. I will caution, however, that these numbers do not include data from all hospitals, so the numbers will likely be higher than what is being reported. I'm going to turn it back to Dr. Williams now for some comments.
Well, thank you, Dr. Yaffe. And so the numbers and the trends are concerning. And we continue to see elevated numbers in our main regions, as well as in other parts around the GTA-HA, and we're monitoring that carefully at this time. It should be noted that these elevated numbers, while the new framework has released on Friday at midnight, I've been out for a few days, that the numbers we're seeing today for most of the major four, that's Toronto, Peel, York, and Ottawa, are numbers that are recorded back when they were in the modified stage 2 in that. And in consultation with the MOHs at that time, that while they were, as the modeling team had said, that they have had some impact, as in to flatten the rise or the speed of rise of our curve, such that they were predicting if we didn't do anything way back then, we would be by now heading to maybe 2,000 to 3,000 cases a day. But they were telling us back in the past that by doing some of the measures we were undertaking and people doing what they need to do, we were bending the curve so that we might be at numbers between 800 and 1,200 by the beginning of the month. And here we are with our average just over 1,100. So while it is reassuring that we're staying on that trajectory, it would have been nice, in my mind, to be lower and to be driving that down even further. So the key there is that besides the stage levels, people have to be attentive to following the public health measures, and that's a measure. That's something we can't overemphasize in this whole point, is that it is within reach of us to bring it down even further, because if everybody does what they're supposed to do with the social distancing, keeping to the households, limiting those types of congregate communal gatherings in the private or in other settings, making sure if you're ill you stay home, to get tested when you need to be tested, hand hygiene, and all the other measures, including the masking in the public spaces, that if everybody did it, we could drive the whole province down to the green level in about 3 to 4 weeks. Now, that's pretty aspirational, I know, because a lot of people at this time are suffering, I think, from COVID fatigue and are seeing some laxity in other parts of the world. But of course, if they watch other parts of the world, those ones have moved quickly and have stepped on up into so-called lockdown situations, especially in Europe. So we have to make sure we look at these numbers with a certain level of sobriety and saying this is a concerning trend and direction. And while we may say, well, that's only in Peel or other areas, the numbers still in Toronto are consistently up. With the population, they're not as high in the rates as Peel and parts of Peel, but it could be in a neighborhood or near to yours. We have to put all these precautions in place and to take these issues seriously. And it's really in the hands, as we always said, with Ontarians. And I like to say that we did it before, and I really feel confident that we can do it again. But that means those that are choosing to take a casual approach are sometimes being swayed by some of the social media or by some of the media reports with the various opinions to be confused in the matter. We have not been confused of what we need to tell you to do, and we've been doing that consistently throughout the whole process. So we have time that we need to really work at this right now. I know Dr. Lowe has put out even more stipulations, as is his responsibility to do in Peel and in consultation with my office. And he continues to do that. And the people in that jurisdiction really have to listen carefully to what he's asking you to do and to take those extra steps to do that before we have to look at other concerning issues that where it impacts your long-term care homes. It has impacted the hospital. We've done steps to move around and to support Osler, the hospital, William Osler, and others around there. But it could have more impact on your long-term care facilities. But we're hoping to hold that off as best we can. But what you can do is to get those rates down, get those numbers down, protect yourself, protect your family, minimize your amount of socialization. I know it's coming up to a festive season with Diwali, and you can do that, I think, in a socially distanced, safe way. Still celebrate the key points of it, but being protective and careful of you and your family and your loved ones, especially those that are most vulnerable. So these are the comments I would have at this time. We're going to be watching this week very carefully. And not only, as Dr. Yaffe has alluded to, Toronto and Peel aren't the only ones. In York, Ottawa, we've seen some success, but they're not totally right down yet. And we've got some other areas around the greater Toronto, Hamilton area that have concerning numbers that are posting right now, and even some in the north, the northwest, and northeast, again, due to localized outbreaks that they're managing. But it doesn't mean everybody can just be casual and put it back. We have to be very concerted on our efforts to contain this personally, family, household, and in our circles that are friends and that, and to challenge each other to say, we really need to be more careful on this. Let's really be careful in the next 4 to 6 weeks, especially, and 8 weeks, to see if we can drive these numbers back down and get us below the modeling projections to even lower levels to avoid any future concerns and lockdowns, which is always out there in the framework. So those are my comments, and with that, I'm going to open up for questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
First question comes from Dave Woodard at Global News Radio 640 Toronto. Please go ahead.
Good afternoon, Dr. Williams. Taking a look back at the beginning of this pandemic and the policy of putting an iron ring around our seniors, things like making it more difficult to visit them in long-term care homes, asking those who were 70 plus to stay inside and distance themselves from everybody else. Taking a look at the results from that iron ring policy, can you say that that was, at the time, the right thing to do?
At that time, I think it was the right thing to do. We had already put out memos to limit movement of staff between the facilities. And when we, if you recall, going back to that time, when we had the travelers coming from different high-risk countries that were of a certain number, we were doing all the case contact management and limiting the spread among that group. When we had the very large number returning from March break, from the what we had heard from the American authorities, that there was not a lot of cases in the eastern seaboard, which I think was misunderstood. So a lot of people came back all at once throughout Ontario. unbeknownst to them, having been infected by COVID, a number, and so that spread writ large throughout the province in a number of areas. At that time, still, as those numbers went up, the numbers in our long-term care facilities did not go up right away. Even though our hospitalizations started to go up, they were delayed by about 3 weeks. But then we found that all of a sudden throughout the province, not from place to place, a number of staff of certain levels were coming into those locations positive, and we started having outbreaks in our long-term care facilities. So the ironclad was not as ironclad as you'd liked it to be. And what we didn't anticipate at that time is a number of people still who could be coming in with mild symptoms or even early symptoms, incubating and transmitted in the homes. And so now this time we put in a lot more stringent around outbreaks and early detection of cases in that. And we're hoping this ironclad is a bit better, but we are still having outbreaks in the second wave. And some are substantial. And so this is a highly vulnerable population, high at risk, and with the pressure and tension around visitation, essential visitors and other aspects that I know Dr. Yaffe is working hard at, we're hoping to be a little bit much more protective. Are we convinced it's ironclad? I think that would be presumptive at best. We're trying to put all the measures we can in place and to keep those numbers down as best we can. So that's a long answer to your question, but comparing the first wave and the second wave, they're different. It's a different type of setting, but some of the measures are still as important, if not more important.
I wonder if I can add to that, because
Please.
I'm quite involved with the long-term care outbreaks. I think it's important to know that we have learned a lot from the first wave, and the outbreaks, yes, we're still, obviously, when we have COVID in the community, inevitably it spreads into congregate settings. But outbreaks are being controlled quicker this time. And we're doing a lot of work around infection prevention and control, human resources, testing, control on visitors, keeping in mind the balance. We don't want to go too far in terms of control and have negative consequences for social isolation, mental health, and so on. So it's a balance between preventing and controlling COVID-19 in this very vulnerable population and keeping them socially and mentally well at the same time. So I think obviously we continue to learn, but it's going much better than it did in the first wave.
Follow-up?
Thank you. And Dr. Williams, follow-up from my colleague, Brianna Carnegie. What factors led to critical staffing levels in Ontario's long-term care facilities during that first wave, and how is the province addressing them during this second one?
And again, I know Dr. Yaffe will have probably comments to make. One of the issues that we identified is that when we had cases located in a long-term care facility, in order to map out and to protect, a number of the staff in a very short time period had to go into a period of quarantine as we sought to ascertain their status during the early days of our understanding of the epidemiology of the virus. That could mean that a good percentage of the staff were then missing from being involved in there, and especially as it spread, it came into more compromise. That's why the IMS group, even in the first wave, started to bring in other resources, including the military to assist, but also with hospitals and that linkage with Ontario Health, and working across to have hospitals in the areas to give support in not only staffing, but also infection prevention and control. And we're undertaking that. I'm not sure whether Dr. Yaffe has more comments to make as we try to deal with a number of features that the Minister and Minister Fulton had already announced around human health resources related to long-term care. I'm not going to pretend to go through them all, but Dr. Yaffe may want to make a comment on a few.
Sure. Obviously many issues, but one of the issues I think in the first wave was around lack of PPE, personal protective equipment, lack of access to personal equipment, and I think that certainly is not an issue now. However, it's important to make sure that staff are trained and know how to don and doff, how to put it on, how to take it off, when to use it, how to use it, and that's something that's very closely monitored now. And that's part of infection prevention and control. And of course, if they do become infected or they're a close contact of a case, they need to stay off. for 14 days after exposure, so that contributed. But there's, and I think the minister has talked about a big health human resource strategy that's being undertaken to educate and bring in more staff into those facilities.
Next question. Next question.
Rob, your line is open. Please go ahead.
Oh, sorry. Are you calling on Rob Ferguson?
Correct.
Oh, I'm sorry. Wanted to check back in on something Dr. Williams said earlier, that the province could be in the green zone in like a month or so if everyone followed the protocols, the pandemic precautions. But they appear not to be. So is that even realistic to say that?
Well, Rob, that I understand it is an aspirational comment. It basically states the protection and how you disrupt the transmission. And by doing all we do in all those processes, because it is a aerosol droplet spread type, we know that if people did everything they're supposed to do, you need to get it from someone. You need to get it from someone in a certain context by being close to them in proximity for a period of time. And you need to be exposed in various other issues and settings that we've put in all sorts of processes and protocols in place to protect from. If we follow those to the T, assuming, of course, we don't get a lot of people traveling into the country, not adhering to the quarantine, that's always a risk. We keep trying to monitor that. Then there's no doubt we could drop those rates down because you have to get it from someone. And if for over 2 full incubation periods you have no exposure to anyone that is positive, you can see what impact that would have. But as you alluded to, it seems that we're dealing with a large percentage of our population, or a good number, that whether it's through COVID fatigue, and yes, I understand that. And it's like in a long distance race, there's a tendency to start to lay back, and you know that what happens there, and you end up seizing up after a while. So I think you have to keep refocusing again, stay at the task, do what you need to do, not only for yourself, whether you are fully in adherence, you have to do it on the same because of the community you're involved with, and everybody has to do their part to bring those down so you don't compromise the community. So we're trying whatever we can. I know Dr. Lowe's working at it to get people in those areas that didn't seem important, because when we do the interviews with people, they'll often say, I guess those parties I went to back 3 or 4 weeks ago, I didn't think it was a big deal. I guess I got sort of tired. I wanted to sort of lay back. And I guess I thought everybody was okay, but I was probably wrong. And someone is exposed, and I guess those 3 parties I went to after I became symptomatic, I shouldn't have gone to either. And so it's like I laid back. I didn't follow the protocol. I should have, and now I should have even been more careful. And we're asking, let's not have those scenarios. Let's hear that everybody did all they needed to do, because we can bring it down. It's within our grasp. We did it before, and I think we can do it, Rob. But that's aspirational, I know. And but the more the people do it, the more we can try and get a handle and maybe get back to case contact. If we can't get down to green, can we get down to yellow and get our case contact people back into a level where they can cordon it off and hold it back at that stage?
Follow up?
We've seen a steady increase all along. The 7-day average is now 20% higher than it was 1 week ago for new daily cases. So at what point do you lose patience or get really concerned that something more has to be done? I recall the briefing we had a couple of weeks ago said we're kind of on the Michigan trajectory, but I will note in the last 2 days, Michigan's reported about 4,500 cases a day. So the Michigan trajectory ain't really a good thing to be on right now. So aside from the framework, what kind of case numbers are you going to need to see before the province stops leaving it to local health units to impose new restrictions like Peel did on the weekend and like Toronto appears to be out to do?
Well, I think, and you've hit on the points there. If you take our numbers now, if you take Peel and Toronto alone, that pretty well gets you up to the 1,000 around there, or 800, 900. So it leaves the rest of the province still with some areas, and they're trying to cordon those off and continue to do those. if the extra measures put out by Dr. Lowe and whatever Dr. Davila is planning to do, because they wanted the extra week to put things in place, they know they have to do something, because even in Toronto, while their average is less than Peel, there are some parts of the city that are as high as some parts of Peel, and concerning to Dr. Davila, and they're trying to get that messaging out. So I think, Rob, what we need to do, I agree that, and especially, of course, what's gone on in the U.S. lately, I wouldn't say I want to totally emulate Michigan. I'd like to be below that. We are well below that, and as the Premier comments on that, our rate per 100,000 with a jurisdiction as large as Ontario is one of the lowest ones in North America. That may give us some sense of comfort, but I wouldn't say it gives us any sense of laying back and being casual. We can quickly jump up to the top if we're not careful, and I think that tells us that we can do something. We can make it happen. If we do it, we don't have to go into lockdown. We don't want to go into lockdown if we don't have to. While the rest of Europe has gone that way, I think it's totally within our powers to bring that down, looking at Toronto and Peel to really do their best. And that means not only the MOHs, the leadership in the communities, as well as the citizens, and down to the community groups and levels. Everybody can do their part. I think collectively you want to bring that down. You don't want to see your long-term care homes get locked down into certain limitations. You don't want to see the schools closing in there, because if you get too many cases, they're all coming from the community, and we're sensing that, and you don't want to have that happen. You don't want to have your hospital systems start to overrun where they have to start canceling elective surgery again and required surgery. So it goes beyond just what personally you like and don't like about when you can go out to restaurants and things. It's much more important what you do personally with your protection around yourself, your family, and your household. It's very important and critical at this time. So I agree, Rob. I don't want to emulate Michigan at the moment. I want to get below that for sure. And so we'll hear some more, I think, on Thursday from Dr. Brown on how the revised analytics and modeling looks, and how if we are emulating Michigan or not in that regard.
Next question.
Next question comes from Graham Richardson at CTV Ottawa. Please go ahead.
Hi, thanks for taking my question. Following up Rob's question, with all due respect to both of you and to your entire team, I really think everybody has tuned you guys out. I just don't think the behavior is changing, both anecdotally and the numbers. The averages here in Ottawa over 7 days are actually down. But what do you say to the notion, Dr. Williams, you're talking about aspirational things, about getting people to change their behavior. I really think they've tuned you out. And how do you get them to not tune you out? Because these numbers are just, they're telling a very different story than what you're talking about.
Well, yeah, I think you raise a good point. What's tuned in, tuned out, or what are people saying, I've had enough, I'm going to do my own thing, and I'm not sure that's me in particular. I think is some concern about generally as people say, well, in other sectors we watch what's going on. We see what's happening south of the border, the portrayal of different perspectives in the media and the social media. And so people are, I think, at best confused on the matter. I think if they tune out on issues, I mean, are they listening to local public health in Ottawa, to Dr. Etches and to the leadership there, to the mayor? With Dr. Davila in Toronto. So we're not the only voice that's here to be listened to. And the question is, in the public's mind, what is the value added of staying at the task and coming back into it again? And so these numbers, I think, when they're seeing them climbing up, going up over 1,100, 1,200 to 1,300, I think is a wake-up call to say, I guess it's not just talk and casualness. These are real numbers. This is really happening. And to say, can we go into a situation more like Michigan, as Rob said, or do we go into a European situation where the officials are going to be forced to do lockdown? And that's a reality that's there, that's facing it. And so one is that you have to catch people's attention. And part of that is not with hyperbole, but with actual data and facts, and they can see what is happening and listen to see what Dr. Lowe has to do in Peel, and we're going to hear what Dr. Davila is going to have to do in Toronto. So this is not just conversation. These have implications, and down the road even further implications about it'll affect you whether you adhere to the principles or not. Your freedoms and your issues on that will be limited if we get into a lockdown. That's just the reality, and people have to understand that. So I am concerned about the tuning out. not just tuning out to me, tuning out in general to the evidence and the science. And people are getting misscience and misinformation from different media sources and from social media. And I think we really have to make sure you listen to your public health experts in your area and listen to what your medical officer of health has to say and their staff as well, and what we're saying, what the Premier's saying, what the Minister of Health is saying. We're all having the same messaging. So we need you to tune back in again.
Follow up?
Yeah, and don't get me wrong, I wasn't trying to blame you personally or Dr. Yaffe. I just think the fatigue factor is very, very large. And I just don't think, looking around anecdotally, there's traffic jams, the patios are full in some cases. I don't see a lot of people changing their behavior radically as these numbers go up. And I guess my question is, all of the measures that you've taken, would it have been better to go harder, faster, like a New Zealand or like a Melbourne, and dealt with all the pain and brought them down lower, and we might be in a better situation than we're right now?
Well, I think it's a good question. We have looked at that aspect there, and knowing that there are other sides with the situations. If you do that with economic and impacts on people's mental health, that's part of the fatigue. Whether it's children and schools and that's why we have not closed our schools back down again. And with the visitation in the long-term care homes. So we're trying to do a fine balance here because issues of finance and income and other aspects there are very important. We know that at the moment, the action in Melbourne seems to have had effect in wider Australia, which is interesting why it goes beyond Melbourne to other larger cities. How did that work? They both are islands. They have better control on who comes in and out, and so there. Some others have tried different methods in Europe and have not been successful. So I would say before we say that someone has the exact correct formula, we're going to look at those. We always consider those. And ones that were successful, we heard, are now back down into another situation. There's nothing like a virus to keep one humble in these situations here. And so there's no recipe book and no one's got the perfect formula. We continue to be driven by the evidence, their experience. Our experts are looking at that, studying that, trying to see if it applies to here, and moving quickly in one area, you compromise in others. So we are seeking to get the right balance at this time, and we are continuing to encourage the citizens of Ontario to take that. And I know there's people throughout Ontario have and continue to take the messaging very seriously, but are concerned that fellow citizens in the area are not doing the same. So I think we have to see if there will be a coming together on this aspect to drive it down, or we will have to take measures, as you've seen, that are already happening in Peel and perhaps in Toronto, and we may have to do it on a larger basis in Ontario. So all things are possible. We have to look at those and see what we can do to protect our vulnerable. As our goal was overall to want to keep down the morbidity and the mortality of COVID-19 and our key resources and our services, especially healthcare services and other key ones that are in our population. So all things are being observed, watched, and studied, and to see how they're doing in the long run.
Last question.
From Ashley Legasic at News Talk 1010. Please go ahead.
Hi, doctors. Thank you for taking my question. And this is kind of bouncing off of Graham's first question. I'm wondering if there has been any research done here in this province about why people are being flagrant about the rules, specifically what rules they're not adhering to, and what it would take for them to switch their attitude back and get out of that COVID fatigue.
We have wanted, and we have been doing some survey of the public's attitude towards different aspects there to get a sense of where they're at. We'd like to do more research on that. It changes as people watch other jurisdictions, as people see what is brought to their attention through various social media, texting information, and that. You're hearing lots of controversial, as globally there is fatigue, as globally there are counter movements. To say that it's various theories, conspiracy theories and different things that makes the public think that the message in the science is less than valid. And you've heard that dialogue going on global perspective. So I think we're trying to get the public to say, much like I think they're trying to do in the United States with having the evidence base being built back in again to make sure there's the scientific foundations. We're trying to say you need to focus on that science. We have our national tables. I know that Dr. Yaffe is involved in a lot of the federal, provincial, territorial tables. Lots of scientists across the country that are interchanging with the WHO, with global experts and that. And as we learn from each other how to go on that. So I think the point is that how do we test to see what is the impact of COVID fatigue. And it's a real thing. And we understand why people are getting tired of it. They're wondering what's going to happen with our festive seasons coming up here. We have Diwali in a week, this coming week. And we have still Hanukkah and Christmas coming shortly and New Year's. So all these things are there. And how do we do these in a safe way that we don't then wrap up the numbers even higher as people get a sense of wanting to return to their version of normal too soon rather than adopting the new normal where they can do these things and still celebrate with the protection in place until we have the provision of the vaccines. And you've heard some announcements about that are encouraging and hope building. And people then need to keep vigilant on the activities until that arrives. So, we'd like to understand that better and what can be done to encourage people to focus back in again, to encourage them to get back out of the fatigue, to get enthused about being vigilant and staying at the task, and knowing that there is an end in sight as we go through and get these vaccines in place. So we're building on that, and what used to be when we said in the summer, not until late in this year and early New Year, that's not so far off now. And so we have some announcements that are coming forward, and we hope to have more on that in the very near future.
Follow up, and this is the last question.
Much for that. I'd really like to hear from you both on this next point. And Dr. Williams, you touched on this, the misinformation and the conspiracy theories that are going around. And I have even myself seen some people I would regard as quite intellectual kind of spreading this false information, lying about the survival rate, saying it's 99.9%, which we know is not true. What do you have to say to those people who are spreading misinformation and therefore leading attitudes to feel like they shouldn't be concerned about COVID-19?
Well, I've been doing most of the talking. Let Dr. Yaffe answer one, and I may have a comment afterwards, but over to you,
Sure.
Dr. Yaffe.
Well, as Dr. Williams said, I think, there are certainly a lot of people who don't believe in science, don't believe in evidence, and, there's a lot of misinformation on the internet, and it's very hard to argue with those people. They just don't want to believe it. I think part of it is they don't see the risk for themselves or their families. And with a virus, that's, you don't see the virus. It's not like another big emergency like an earthquake or a flood or something where you actually see the results and you can feel the impact on yourself and your family. Unless you know somebody who's had H1N1, been hospitalized, got sick, perhaps unfortunately died, it's very hard to see the effect. And what you see is the impact on your life. I know I've had, people tell me, I'm getting depressed. I can't stand, staying at home so much. I'm having trouble accessing my usual health care. There are all sorts of other impacts that people are feeling, and they don't see the virus. So I think that's why, and it's hard to get that message across, but I'm remembering with H1N1 influenza, people were saying, oh, it's no big deal, it's flu. And the first day that Toronto Public Health, which is where I worked at the time, ran a clinic for flu vaccination, a young child died of H1 influenza. And all of a sudden, everybody was there waiting for their flu shot. So until they actually see that it's serious and they can relate to it in their own life, it's very hard to get that message across. But it's a whole science that people are still looking at. And also maybe looking at more information on social media, information from people that they respect in their community, champions, maybe even celebrities. There's lots of different strategies that we try to use. I'll turn it back to Dr. Williams.
Yeah, and I think, I can understand how people are getting fatigued, and some are turned to these theories because they're saying, when is enough, and they feel that their life has been heavily compromised in what they were hoping to do, and they were planning to do something A, B, or C. And it's getting perplexing them and saying, well, I think I'll just go to something that gives me a better sense of some hope and some way to go. And they jump onto some theories and ideas there. And I think what we fail to understand here, especially in our response in Ontario and in Canada, that for the most part, a lot of people's lifestyles, while they have been encumbered to some extent, there's still a lot that you have and that you have benefit of. And there's some, having worked overseas, there's some of the countries, and I'm getting the aspects coming in there, that when some of these things come down, it really does get harsh. And lots of people dying of the secondary causes of starvation, lack of income, lack of housing, and this is really coming down heavy. In one way, in Canada and Ontario, we do have it very well. We have a lot of benefits and blessings that we can keep in place, and we're trying to do that, and we're holding on to those. So don't think about the cup always being half empty. Think about what you have and in that cup already. Even though there is some compromise, there's lots you still have. You can, as someone commented, there still seems lots of cars on the road. There still seems to be people taking takeout food. There's still people going to their fast food and still buying and taking it out. And people's, one of the concerns is they're putting on too much weight during COVID and these kind of things there. So there's lots of things we have. And so take a look at that and then saying, okay, let's keep that in place and let's keep those things going on that, because we've worked hard to invest in that. We are fortunate than some others, and that's, I'm not gloating, because those others are in pretty dire straits, and there's some on the international, and a lot of those metrics have really deteriorated, whether it's in vaccine preventable diseases and globally, things are just, it's really getting bad in some other areas. But we have lots to be thankful for. But I understand that fatigue, and especially some of the younger people saying, when is enough, and they're looking for some hope and the end in sight. We said there would be a second wave. To come and say, well, we didn't know this was coming. We told you it would be coming. It's a wave. It's not a continual peak on that. So it'll come down. And by that time, we're hoping to have vaccine, and that coming out early in the new year. And so we look forward to that. And then when there can be some more resumption of those things that right now you feel really down about because you can't do, it's within sight to get. So I understand that fatigue. I sympathize with that, empathize with that, and everybody's feeling that. But we have to weather through this and push through it, much like in a long winter. You have to look for the spring, and let's do that. So I'm not saying it's sort of dissing totally people have gone on to that, because it's something they're trying to grab and reach out for. But I think I'm trying to encourage you to stay at the task, listen to the science and the evidence, the evolving epidemiology, your local leaders in that area there, and stay to the task, because we will win out on this one. We just have to keep at it and not grow tired and weary as we do it. And I sympathize with that, and I'm trying to encourage you to stay at the job, because collectively we'll pull through on this one. So thank you.
Thanks, everyone.